Hello and welcome to the Burn Clinic at Sydney Children's Hospital. You are watching this video because your child has had a burn or skin injury and has been referred here to have their wound assessed and dressings changed. This video aims to give you some information about our burn clinic, as well as about the dressing change, and also some coping strategies to help you prepare yourself and your child for the clinic appointment. Our clinic sees children who have sustained minor burns or injuries. We usually see our patients on a Tuesday afternoon in the outpatient department. There may be lots of other children attending this clinic, so we thank you for your patience in waiting your turn. Allow your child to play in the waiting room. You will meet lots of different people who have different jobs to help your child. Please give your child Nurofen or Panadol before leaving home. This will help them to have a more comfortable dressing change. The nurse or doctor will ask you to describe what happened during the accident. The bandages will then be removed by nurses. This will involve cutting of the bandages, spraying with an anti-adhesive spray, washing the wound or soaking it with water. There is a child life therapist present to help to distract your child and help to manage you and your child's experience. We need to clean the wound so it can be accurately assessed. Nurses and doctors will look at the wound and decide on what sort of dressing is needed. There is a photographer to photograph the injury for our records. Your permission will be sought prior to the photos being taken. There are lots of different dressings that may be used. The commonest one is a silver-based dressing. Some of these can feel somewhat cold when it is put on. A physiotherapist may put a plaster on your child to keep the dressing in position. Our aim is to get the best possible skin healing to maintain good cosmetic and functional outcome for your child. We will explain how you should look after the dressing at home and give you a fact sheet to remind you of these details. Generally, the dressing is meant to stay dry until you come back to see us in 1 week. This next section will address how you and your child can prepare for a better experience in the clinic. Your child may feel upset, scared, anxious, overwhelmed, vulnerable, worried, and not in control around the time of the dressing. And these are all natural. You may also feel very similar experiences: upset, worried, guilty, overwhelmed, scared, anxious, and out of your depth. It is normal to feel any or all of these emotions. Distraction can be used during the dressing change to help minimize the level of anxiety and pain that your child may experience. You can have them sitting on your lap, if appropriate. We can also help with slow breathing and helping them to count. To prepare your child for the appointment, you can show them this video. Stay calm when talking about the appointment. Be honest about what's going to happen at a level that is appropriate to them. You may want to have an enjoyable activity for after the appointment, and please inform staff if your child has any additional sensory or behavioral needs. You may bring their favorite toy or have a treat for after the appointment. Most importantly, you should try and keep calm, as that will help your child to stay more calm as they look to you for emotional cues. For yourself, if you are feeling anxious during the appointment, you can tell the team that you are feeling anxious or feeling uncomfortable. Take slow, deep breaths. Ensure you are sitting down. You don't have to watch the procedure. You may look away or ask to go outside. Focusing on your child or the child life therapist may help. We hope this video has been helpful in preparing you for your visit to the burn clinic. Please feel free to approach the staff if you have any concerns or questions.